With the sword of delimitation hanging over their heads, the South Indian states have since last October shown terrible anxiety, with two chief ministers, Stalin of Tamil Nadu and Chandrababu Naidu of Andhra Pradesh, openly exhorting the people to not only have more babies, but sooner, and also have offered incentives. Listen in when I come back to the story.
ఒకప్పుడు ఇద్దరు పిల్లల కంటే ఎక్కువ ఉంటే పంచాయతీల్లో కంటెస్ట్ పోటీ చేయడానికి వీలు లేదు, మున్సిపాలిటీలో పోటీ చేయడానికి వీలు లేదు, కోఆపరేటివ్ ఎలక్షన్స్ పోటీ చేయడానికి వీలు లేదు. ఇప్పుడు కొత్త చట్టం అది చేశాను, మళ్ళా ఒక చట్టం తీసుకొస్తున్నా, ఇద్దరు కంటే పైన పిల్లలు ఉంటేనే మీకు పోటీ కరువులు. మీరు ఇప్పుడు
முன்பெல்லாம் குழந்தைகளை நீங்கள் பெற்றுக்கொள்ள வேண்டாம், அவசரப்பட வேண்டாம், கொஞ்சம் பொறுமையாக இருங்கள் என்று சொல்லிக் கொண்டிருந்தோம். இப்போ சொல்ல வேண்டிய அவசியம் வரல, சொல்லக்கூடாது. இப்போ மக்கள் தொகை அதிகம் இருந்தால்தான் எம்பிக்கள் அதிகம் வரும் என்ற நிலை இன்றைக்கு உருவாகி இருக்கு. ஆனால் நாம் குடும்ப கட்டுப்பாட்டில் கவனம் செலுத்தி அதில் வெற்றி கண்டோம். அதனால் இந்த நிலை நமக்கு ஏற்பட்டிருக்கிறது. அதனால் இப்போ யாரும் உங்களுக்கு குழந்தைகள் நீங்கள் அவசரப்பட்டு பெற்றுக்கொள்ள வேண்டாம் என்று நான் சொல்ல மாட்டேன். உடனடியாக பெற்றுக்கொள்ளுங்கள். ஆனால் பெறக்கூடிய குழந்தைகளுக்கு
Now, so far as incentives go, Chandrababu Naidu had said, and I quote him here, an individual can become a sarpanch, municipal councillor or a mayor only if he or she has more than 2 children. Now, the two chief ministers call for having more children is of course based on the real fear of southern states losing representation due to lower population growth. Data shows that based on population of respective states, in 2026 Lok Sabha seats would rise to 753 as compared to current 543. But as published by South First, the advice proffered by Naidu and Stalin shall most likely take several decades perhaps to bear fruit, as fertility rates in South India have dropped more sharply than what was estimated according to newly released data from the Sample Registration System SRS 2021. The report shows that all the 5 South Indian states manifest a total fertility rates, that is TFRs, between 1.5 and 1.6 children per woman, which is well below the replacement level of 2.1, which is required to maintain a stable population. The report could perhaps raise an alarm, as this is bound to have long-term economic and social implications on the southern states. The most obvious fallout is that with a low fertility rate, the states are bound to have smaller generation, restricted societies, and as shown on your screens just now, let's take a look at this. You know, the disparities which are there, the birth disparities, the impact on population size, the decline of TFR in southern states. So even if there is a large implication for Chandrababu Naidu and MK Stalin, and which is completely political in losing seats and therefore losing the muscle power to legislate and also get grants from the centre, let's understand why did total fertility rate in the south fall so drastically, and is there really a way out to correct it? Let me now welcome Dr. Srinivas Goli, Associate Professor at Demography, International Institute for Population Sciences, who is joining us live. Dr. Goli, thank you so much. A topic you are an expert on. We've had several conversations on this. Why has it dropped so drastically? I was told because we South Indian women, we were educated, we had more of an awareness over the years from independence to now, when the average TFR was 6 kids per woman apparently, correct me if I am wrong. We studied, we got jobs, we wanted to be more, active when it comes to the outside world, and then we decided to have, lesser children. The impact, Dr. Goli, on this, considering that there is delimitation, not just delimitation, other factors. Dr. Goli, where did the government go wrong? Did they overdo the hum do hamare do aspect of it in the south?
Yeah, it's true that the fertility rate is, of course, continuously falling down, and it might go further down because now if you look at some of the urban pockets of the states which have 1.1, so in the future you can see it going further down. Then why it is happening? We have several times we discussed on your show itself that the motherhood penalty of having children is very high when women is becoming aspiring and they need their they're demanding for the gender equality, which is very right in its way. Uh, so there is still a lot of gender inequality at as the domestic course, and also labor market, though it is slightly improving for a higher educated women, but not for all women, like especially from the lower educated and middle educated women.
Yeah, also
Till the
joining us, Dr. Goli, is Dr. S.K. Singh, former director, International Institute for Population Sciences, but he's joining us on the phone line. Dr. Singh, warm welcome to the show. You're watching the South Indian Survey, discussing a very important talking point, which is how the TFR has really gone down in the southern states. A very big cause for concern. Dr. Singh, can we still make up? Can we still kind of catch up with what is the national average, Dr. Singh?
Basically, yeah, we should not turn the vehicle at this stage. Since long, all South Indian states has done extremely well in case of population control, population stabilization, and even the most recent National Family Health Survey shows that if we are looking at the estimated fertility and wanted fertility, it was between 1.4 to 1.6. That is why the decline which we are considering as a surprising, to me it is not surprising. It has taken place primarily because of 5 reasons. Those 5 reasons Goli has already mentioned, that women's empowerment is very high with better education, better awareness, better economic empowerment since long. That
The
has
repercussions,
virtually
Dr. Singh, sorry to interject you. Now there is a delimitation which is happening. The southern states have raised an alarm that they will lose the seats. But apart from that, the other impact of it, aging population, a lot of focus on
absolutely.
pension and healthcare, sir, and the workforce, which will deplete, don't you think? For the economies of these states and also the social well-being, this is an alarming situation, Dr. Singh.
But frankly speaking, labor force, there is absolutely no problem because already internal migration is very high. Population aging is definitely a cause of concern, but I am pretty sure government has already adopted various measures for the health and well-being of elderly in the country. That is why population aging with demographic advancement is a natural phenomenon. That is why we will have to come up with alternative strategies
That
to
is what?
address our
Yeah, what is the
priorities.
alternative? Dr. Goli, what is the alternative, sir? Because if you have a very low working population and you have an aging population, the aging population requires care. Where does the economy get the money, Dr. Goli? Immigration is okay, but then immigration will also change demographics. Correct me if I am wrong, Dr. Goli. What is the way out?
See, there are three way outs. One is what Professor S.K. Singh pointed out, that we can increase internal migration. So we have deficit at one region. So we have slightly not surplus, because North Indian states also fertility is declining very fast. So it will not be very long, but still now they have surplus. So that is one. But the other important uh, solutions are, one is enhancing the healthy and active aging, the productivity of aging population, which most European countries or other developed countries are pursuing now, because wherever the migration has becoming a problem, because it has bringing its own issues, and the migration is not a very automatic process. It's not a prepared process in India. So therefore, we don't know whether it will uh, bring the desired results uh, uh, if you encourage an unplanned migration.
So,
So
Dr. Goli, correct me if I am wrong. It is an alarming situation.
yeah, definitely, it's a like currently the aging problem that we peep up in the South Indian state, definitely an alarming process, given that we are aging with very lower economic status.
Right.
Because if you look at the aging proportions of the South Indian states and their corresponding economic status with the developed countries, we are 20 to 30 times lesser per capita income, lesser economic growth than the economic size than the
All
developed
right.
countries. So therefore,
Yeah.
our
Yeah.
infrastructure is not in a position to take care of them. But of course, we need to prepare, because this is, as
You know,
Professor S.K. Singh also pointed out,
yeah, we
this
need to
is
prepare.
natural
Yes, you're
process.
right. Yeah, go
This
on.
is a natural process, so that we need to get it adopted to that. But of course, a
I,
strong policy
yeah,
required
yeah,
to
yeah.
overcome these issues.
Dr.
But
Singh,
fertility reversal is not a possible, because you cannot ask women to just go and have births. That is
exactly.
not
You
possible.
can't do. That's what I was coming to. Dr. Singh, tell me, how do you convince a young person today to have children because she's going out to work? It's a choice that she and her husband do not want to have children. They are happy without kids. I want to ask you that all these chief ministers exhorting their people to have more babies. This is not a magic wand. It's my choice whether I want to have 1, 2 or 4 children. How do you do this? What is the policy? Should you make, I mean, also the domestic situation, the child care is abysmal in this country. We don't have joint families where you can leave the children so that they can be under the care of family members and I can go out and work. You know, there are multiple problems here, Dr. Singh.
Looking at second demographic transition, China and other countries where fertility has gone very low, now they have started experiencing second stage of demographic transition. Theoretically, that will start only if our TFR is going below 1.6. And now all our 5 southern states has gone to that stage that may experience any moment. That should not take much time in that. Regarding delimitation, definitely this is a political issue. And I sincerely feel that any state which has done excellent in terms of population stabilization, they should not be disadvantaged. And that is why those chief ministers should argue on to the commission, delimitation commission of Government of India, that our parameters should be reconsidered rather than asking people to produce more number of children. Because if you look at the 5 different reasons are behind that, some preference has been
Right.
completely eliminated. More than 80% of women having 2 living children, where both children are daughter, has reported that they don't want any more children.
Right.
That is the situation.
Yeah.
That
Dr. Yeah.
simply by appeal of Tamil Nadu and Andhra Pradesh chief ministers, I am pretty sure the issue of social, deep-rooted issue of some preference is not going to change over time.
Yeah, so Dr. Goli, you know, your colleague says, your peer says that it's not going to change overnight. Now, I do not know about I'm not talking political aspect is there, how South Indian state chief ministers, you know, handle this and navigate around this. But Dr. Goli, don't you think that we have come from that stage to this stage? Now, how do we retrace our steps? I mean, there has to be, you spoke about immigration, you spoke about how, you know, the Western world is doing it. I think Korea and Japan are examples, correct me if I am wrong. But so far, let us take Andhra Pradesh, you know, a Telugu speaking state, you know. How do they do this now? I mean, how do they go back, you know, and to see to it that the families are, you know, well ensconced so that they can have more children. Secondly, Dr. Goli, who can afford 3 kids now? Where are the schools? Where is the money to kind of raise these children? Don't you think there are multiple problems, Dr. Goli?
No, it is like it's impossible to reverse the fertility. That
Right.
is for even if it is, there is no example in the world that a country reversed the fertility for a long term with a considerable size. Okay, the only country which rebound the fertility with a lot of incentive is the United Kingdom, which 1.7 to 1.9. So point two. So that much only. In Korea, people are reporting now, but that is not very stable rebound of fertility. although they have invested a lot. So for options for Andhra Pradesh is to invest more on gender equity, creating employment opportunities, providing the paternity leaves along with the maternity leaves, bringing gender equity. These all are not very easy solutions to work with. So the fertility reversal is not a easy solution for the southern Indian states, considering especially their physical condition, their financial condition, because they have to deal lot of other issues which are especially health, aging, education, then other important social welfare programs are also there. So the better solution at present is to basically work around enhancing healthy and active aging, and of course, if possible, build more policies around bringing the gender equity around the household level. But otherwise, it is impossible to reduce the cost of rearing children, cost of education, cost of healthcare. These are things it's not any easy, because most
All
of these
right.
are becoming privatized. So
Right.
they are
Okay.
not in the control of the state.